Just checking in on this Sunday. I have some time to do a live, so I wanted to hop in before the week starts and things get crazy. Wanted to check in with you guys about autoimmunity, what's going on with you guys, how you guys are feeling. I'd love to know how everybody is sleeping, how their joints are feeling, how's your rashes going, like what's going on. Are you guys having a difficulty getting diagnosed right now? How's that going? Would love to know how everybody is doing. I've been kind of on a bender lately, just talking about chemicals that are driving autoimmunity, and see if you guys are exposed to any of those. Autoimmunity. Lots and lots of plastics are causing a big problem with people with autoimmunity, right? So plastic water bottles, BPA, all the bisphenols, microplastics, all the things that are going on. Let's see, we're going to be working on plastics and chemicals. Let's see what else we've got. You know what I learned today, which was so interesting, was that there's a really interesting process that is happening with tuna. Are you guys aware of tuna, how they cook tuna in the can with the BPA in it? Are you guys aware of that? Isn't that wild? I need to talk about that in a little bit. Rebecca, you have a question. Is it possible to have a false ANA and Sjogren's reading? Oh gosh, it really could be. You know, this is so wild, right? Where you have one little autoimmune thing, and sometimes it can pop in and it can leave and go negative. So that's an interesting thing. Have you ever had a positive ANA? You have no symptoms. Okay. So it's possible. So, Rebecca, it's so interesting how the immune system it'd be interesting for you to get tested. You know what I would ask to have run at some point, Rebecca, is I would think about having them run an ANA cascade. And that would be an interesting thing to see, just to kind of rerun all of it at one period of time. Sometimes you can have something that's like tipping your immune system and making you, like maybe a virus, maybe you have post-COVID, some people will test positive ANA for a minute and then it'll go back to normal. So you might be sort of tipping on this a little bit. So you might want to just kind of continue to watch it. If you have no symptoms, then I would just kind of continue to watch it, maybe increase your vitamin D. That might calm your immune system down. Sometimes the immune system can be a little bit unsteady when it gets really stressed. It can get sort of like showing positive ANA, and it might not be a true positive ANA. Okay, Red says, I have no symptoms and a positive ANA. That is actually kind of common. I run people's ANA all the time just because I want to see, and it's most people have never had it run. And sometimes it'll be a low positive, like it'll be 1 in 40, it'll be 1 in 80, something sort of low. And people don't have, and you might have a positive ANA that's low forever, that never goes to anything, to be clear. So some people get a positive ANA and it just starts to tick up. So you also want to look at the pattern. Sometimes it'll be something like nuclear, dense, fine speckled. That's a really interesting pattern, because that one shows that it doesn't usually go toward an autoimmune disease, but it does say that your immune system's under stress. So it could be exposure to like endocrine disrupting chemicals. It could be plastics. It could be toxins. It could be a virus. It could be something like that. So that might be an interesting thing for you to kind of just watch, right? And see what happens, especially if you don't have any symptoms. Question about, is elevated white blood cells a marker? Sure, absolutely. So elevated white cells, so you got to think about your white cells are going to go up, and they're going to go up when you are attacking something. You're actively attacking something, right? Now, if you were attacking something for a long time and you couldn't get it to calm down, your white cells would eventually get too low. Your white cells would actually get exhausted. So that's an interesting thing. So if your white cells are, I like to see the white cells like 4, 5, 6, 7. That's a great range. You're managing something, you're handling something. It's pretty normal. Once I start seeing like plus 10, it makes me worried. When I start seeing -3, below 3, that starts making me worried too. Because you could have a chronic autoimmunity can drive your white cells down. So that can be something that happens. So I don't know if you've had a virus lately, or if there's anything that's going on that makes you feel, if you're feeling anything in particular. So yeah. Oh, Rebecca, thanks for popping in. Yeah, thanks for popping in. I'm glad you like to watch the videos. There's so many things to talk about. I get to sit on here all day watching all these things, talking about everything. Mark, any suggestions for CIPD? The IVIG I'm taking is not working. Okay, CIPD, chemically induced immune-based disease kind of thing. Like, what is it exactly are you dealing with? Can you tell me a little bit more? Because I want to make sure I'm answering the right question. Stephanie, your SED rate's 128. Okay, why are you inflamed, my friend? What's happening? What's going on? Do you have autoimmunity and it's flaring? Like, what's going on? I'd love to know what exactly is happening there. Oh, white blood. Yes, white blood cells. Yep, white blood cells is WBC. You got it. Wonder what your number is. Do you advocate the eating of hot dogs? Oh my goodness. Okay, well, that's the only protein you can get. Make sure they're organic, or make sure that they're nitrite and nitrate free, please. Brad says it's 11. Okay. So that's kind of teetery. Anytime that things go above 10.2, it goes out of range. 10.5, something like that on Quest. Then I'm wondering if you're fighting something. Do you have symptoms of an infection? Are your tonsils swollen? Do you feel like you've got an infection someplace? Is there something going on with your tooth? Or, do you notice that you have an infection somewhere? Sometimes when people go above 11, they think antibiotics. So it kind of depends on what your symptoms are on overlapping that. Pus, white blood cells, sure. There's also a lot of inflammatory components that are in sort of infected skin, dead materials, and dead bacteria, and all that stuff is in pus. Wow, we are in wild topics tonight. What is paracetamol in the blood? I have to see a hemorrhoids next month. Any ideas? I don't know what that means. Tino, can you tell me a little bit more? Tell me more. Can positive ANA be caused by stress? Yes, kind of inadvertently. So if you have really high stress, like your cortisol is really high and it's been that way for a while, it can drive you to have like a leaky gut. So you could have, your gut is supposed to be like a sealed tube that is not broken, that isn't open. It should be sealed, and you should be inviting food and particles across that your body needs to deliver as nutrients, right? And vitamins, minerals, things like that. So if you have a leaky gut and it winds up opening, then you wind up having things go across that wall that are not appropriate, foods that are not invited across, things get into your bloodstream that aren't invited. That can drive autoimmunity. So sure, yeah, inadvertently, yes. Tina, okay, protein in blood. Thank you. Paraprotein in blood. Paraprotein. Why would they call it paraprotein? Paraprotein blood. I don't know why. Okay. So if you have that, we're talking about, that's interesting. Paraprotein in your blood, and you have to see a hemorrhoid person next month. What is it? Or what are you dealing with? Do you have bleeding? Do you have something that's going on? You have hemorrhoids that are bleeding? Are you actively seeing blood? That would be something to take a look at. Red has a question. Hold on, I just lost it. So if autoimmune is more likely to have elevated red cells versus white blood cells, it's autoimmunity doesn't always involve the red cell. You'll have things that are related to autoimmunity that involves the red cell. The red cell has to be like packed with iron and oxygen. It has to have B12. There's a lot of things that have to make that red cell normal. So that red cell is oxygen delivery and things like that. But the white cells get more affected because that is part of your immune system. And the autoimmunity means your immune system is on the attack. It's going a little too high and it's attacking you. So it involves the white cells. That's part of it. Neutrophils, lymphocytes, natural killer cells, Th1, Th2, all these things, complement C3, C4, all these things are all they're all pieces of the immune system. And those are the guys that are actually involved in the autoimmune response. So if you have a high white cell, or if you have a very low white cell, if you're having a high white cell, I would think about looking for infection though. That's the rabbit hole that I would look in first. Ruling out where would you have an infection? What's going on there, right? Okay, so if ortho can't diagnose with osteoarthritis and requested only diagnosis from rheumatologist, what would you suggest? So if they're trying to rule out, you have joint pain and they're ruling in or out osteoarthritis versus rheumatoid arthritis, they're going to run two markers for rheumatoid arthritis. They're going to run rheumatoid factor and they're going to run anti-CCP. Both of those if you have both of those together, especially anti-CCP, those are very specific for rheumatoid arthritis. So that would be, you can do that on a blood test and you can definitely, got it. CIPD, chronic inflammatory demyelinating polyneuropathy. Got it. So thank you. Mark, so you've got, it's almost really like an MS type response, but it's a chronic inflammatory process. So we want to think about what's the driver? What is the driver of this? Why is this happening? And what triggered this? Do you have any idea? Did you get exposed to a chemical or heavy metals or toxins? Did it come post-COVID or something like that? Viral trigger? Do we know? This is something that, demyelination, if it's autoimmunity, it would be showing kind of like MS markers in the brain, whiteness in the spinal cord, like patches that are white. It could be, polyneuropathy. It could be happening just in the hands or in patches on your arms or legs. And so it might be called that, a little closer to MS, because it's just going to be out in more of the extremities possibly. So we need to think about the health of the nerve sheath. You want to think about fish oils. You want to think about eating lots of good fats in your diet. You want to think about your fat soluble vitamins, A, D, E, and K. I would think about glutathione. Glutathione is a really nice antioxidant that's going to help your immune system to calm down and have less inflammation. I would think about B1. I would think about B12. I would put you on maybe a liquid B complex, because that's going to cover a lot of those. Sometimes B1 is really helpful in getting the nerves to be not so reactive and calm down that process. I would think about black seed oil. I would think about turmeric, resveratrol. Those are all anti-inflammatories. So we want to think about lots of things like that is what I would think about. But I would also think about what the driver is. What do you think this is coming from? Yes. So let's see what else. Sorry, I'm going to move down just a little bit. Okay. Somebody says 1 in 160 ANA, Marlon K. Do you know, Marlon K, do you know what your pattern is? Speckled, homogeneous, centromere, nuclear, densified, speckled, things like that. Tell me what you think you got. No symptoms at 11, red. So that's a white blood cell being at 11, no symptoms. So here's what I would think about. Sometimes you're fighting an infection and you capture that on blood work, and then you redo the blood work in 60 days and that's gone, right? Because you fixed it. Your body mounted a response and it handled it and it managed it. So if you did another test and it was 11 or 11 plus, I would say, there's a little something chronic going on. We should be digging. If it just might be 5 or 6 when you run it again. So you might just have captured it at a time where you were fighting something, which is pretty normal. We're always fighting something, right? So let's see, Marlon K. 1 in 640, not what I posted above. Okay. 1 in 640 is getting up there just a little bit. So, the markers go The first positive is 1 in 40, then it goes 1 in 80, then it goes 1 in 160, then it's 320, then it's 640. It keeps going up. So they double. So that tells me that there's something pretty active going on. And I would wonder what your symptoms are on top of that 1 in 640. I would also wonder what your, if you have some inflammation along with it, if you had COVID and you started getting symptoms, if you have, just tell me what your symptom pattern is, or if you know the pattern around there. Red, alcohol is the driver. You think of the white cells that you have that are a little bit high. I mean, alcohol does wild things, doesn't it? The alcohol can actually make you look like you have a B12 deficiency too, which is interesting. When you talk about taking glutathione, is it injectable peptide, or you can take either? So you can take the injectable peptide, great stuff. That's really, really like kind of gold standard. There's a couple of liquids though that are really close with absorption. Apex Energetics has one, trisomal glutathione, amazing. Quicksilver has one, Designs for Health has one. These are all just liquid ones that you kind of put in your mouth and they soak in. They're pretty good. I'll bet they're 80% of effective compared to, say, the injectable glutathione. You can do either one. Now, if you feel like you're getting sick, you could do the injectable glutathione. It's going to be fast, right? If you want to do like a daily glutathione, it's a good antioxidant. And I always put it in my liver detox protocols because it's a primary liver detox pathway. It pushes the liver detox pathway. So you could do a methylated B, you could do some milk thistle, dandelion root, you can do glutathione. That would pack a powerful punch as far as cleaning out your liver. So that's a thing to know about too. You want to be careful with that when you're pushing that hard, because you're going to get a detox pathway. You're going to get detoxing happening. So sometimes if people do too much glutathione all at once, they'll start feeling a little bit nauseous, or maybe their skin will break out, or their body's just trying to detox pretty fast. So just go slow on that if you're going to do that. Marlon K says homogeneous 1 in 640. So here's a test I want you to do next. When you have homogeneous, we have to rule out lupus. Okay. Do you know if you have anything like that, or has anybody tested you? You want to think about either do an ANA cascade or you want to do an ENA panel. Now, both of those have different specific markers like anti-Smith and anti-RNP and all these things that kind of rule in or out lupus. So we want to make sure that you're not dealing with lupus. Now, here's how these ANA markers work. You can have a low level and then it starts to grow, right? And it grows a little higher. And so you could be seeing this in early times, early markers that haven't grown yet. And so oftentimes it's 5 to 10 years before people will develop full-blown disease if you're leading to that pathway. Now, there are the outlier people that have 1 in 80 ANA forever and it never changes. We don't know why. This is the immune system. It is really complicated. We're doing our best to try to interpret what's happening. But if you have early signs where you're like joint pain, rashes, exhaustion, and you're developing an homogeneous 1 in 640, we want to rule in or out lupus. And then we want to get to work because there's lots of things we need you to do to calm your immune system down. I need you to be on vitamin D. Like I need your vitamin D to be at 70, 80, or 90. I need you to be on glutathione. I need you to consider getting off of gluten and dairy. They're very hard on your immune system. Your immune system, it makes them more active, makes your autoimmune process work faster, makes it happen, maybe creates more destruction. It can drive it. Okay. So these are things I want you to know about. I want you to know about all the things. Or pills, glutathione. Okay. Yes. So glutathione can be, you can take pills. I would do an AC glutathione. That's the best capsule to absorb. Or if you want to do an NAC every day and an acetylcysteine, great. Love that. That builds glutathione. Okay, even if it's 1 in 40, suggests speckled homo pattern, what would that indicate? 1 in 40, a lot of rheumatologists would complain and say, that's not really positive. But if it's 1 in 40 and it's sitting there and you just want to watch it, is it going to grow? What's going to happen? I would say speckled homogeneous pattern, you have to rule out lupus. It's probably not active enough to have enough lupus markers there for you to do that for sure. You could do an AVISE test, AVISE, that would show you that. That's a company that does all the specific markers. They do a great job. Quest does a pretty good job though. Quest will do it. And, they'll charge you, I don't know, cash, 40, $50 for a really comprehensive panel. An A&A screen is like $7. So things to know. So not sure where we're going with that. Rocco says, I'm a welder. I used to eat dirt when I was little. My blood is strong. So that's what helps you. Yeah. So you're getting a lot of minerals, Rocco. You've gotten a lot of minerals. And when you crave dirt, that's called pica, and you're craving minerals actually. So that's a real thing, real condition. So you might be getting exposed to some heavy metals. You want to make sure you use a lot of protection, that you're not like breathing all that in. And things to think about, you might want to think about binding up some of these heavy metals, depending on what you're working with, right? Are you working with, I don't even know, welders, do they work with lead? Do they work with, I'm not even sure exactly which metals that I should know. My son kind of does some welding. I don't really know. But just being careful about that, about being exposed, right? Being able to kind of process any metals you get exposed to. Rebecca says, so could all the positive from stress after you just worked out with cardio, then you get your blood drawn? Not really. Not really. It wouldn't be transient, right? It wouldn't be a comes and goes kind of thing. If you have a positive ANA that's from stress, you probably got it from severe leaky gut from high cortisol for a long time. And that's a deeper problem that's probably not going to shift just day to day. So probably not. If you have a positive ANA, it's probably there whether you worked out or not. But it's a good question, because sometimes you don't really know. Sometimes you don't really know where you're going to be getting all these things, right? You don't really know. Sorry, I had to kind of kick somebody out who's just being a little rude, but whatever. I don't have time for that. So it says, was in good health till bad COVID strep 2022. And since then, Hashimoto's, Lyme, and mold. Oh gosh, you have some things going on. Okay. So you want to think about, COVID came along, COVID crashed your immune system most likely. And then you probably had a little strep going on, maybe in your gut, maybe in your tonsils, maybe somewhere. And it allowed that strep to overgrow, right? So then it triggered Hashimoto's, and then all of a sudden your barriers probably went down, and now you're being exposed. You're really sensitive to, say, Lyme mold. You don't have the resilience to kind of like keep that going, right? To keep your body healthy. Lots of things to untangle there. You know where I always start with when it comes to someone with all that stuff? I always do a leaky gut panel through Cyrex, CYREX. They have a really good gut panel to tell me I want to look at your barriers, right? Is your gut barrier closed and sealed, or is it open? Is your blood-brain barrier closed or sealed? Is it open? Now, if the way that our body works best is if our barriers are sealed, our skin barrier is sealed, our blood-brain barrier is sealed, our gut barrier is sealed. So we want those to be sealed. It's almost like if you had a skin opening, something would get in there. You would get infected, right? So you want to think about, if you have a barrier like your gut barrier, your blood-brain barrier that is become unsealed, I want you to think, we have to know that first, and we have to seal that up, probably kill off any kind of bad bacteria that are coming in, and then start over. So that's where I would start with you, JC. Yeah, I'm so sorry you're dealing with all that. It is just a nightmare. So I'm glad that you're here. Rare Garden says, my HLA-B27 was negative. I have mostly pain bilaterally, and of the SI joints, maybe sacrum. Okay. So I want you to think about, what you could do. I would love for you to talk to a physical therapist or a chiropractor that works with SI joints. And I want you to get something called a Serola, SEROLA, Serola SI joint belt. That's what I want you to think about. And they want to check and see if your pelvis is aligned. And then they would put this SI joint belt on you to hold it together, to see if we can get that to kind of seal up and close down, especially if you're HLA-B27 negative. It's not ankylosing spondylitis probably. So I would think about that. Okay. All right. And Erica, 9 months after COVID vaccinations, I got incredibly sick, lost 76 pounds unintentionally. Oh my goodness. Um, have you been tested for autoimmunity? Do you know? Do you have any autoimmune anything going on? I would be really curious to know. I have had people having COVID, having autoimmune derived sicknesses. I've had people who've had the vaccine who've had autoimmune sicknesses. So, I mean, it has been that COVID situation was just a nightmare. Wasn't it just a nightmare? Yeah, it was really a nightmare. So how are you feeling now, Erica? Are you feeling better now? Because that COVID vaccine was probably a while ago. Hopefully things are settling down. Do I have a detox checklist? That's a really good question. Um, Here's what I would think about. Well, first of all, when you're thinking about toxins, I want you to like slow your exposure down, right? So I want you to get on your phone. I want you to get the Yuka app, Yuka. And I want you to be scanning things that are on your hair and your toothpaste and your sunscreen and all the lotions and potions that you put on your body, first off. And then I want you to think about just figuring out where you're getting chemical exposure. I want you to eat organic as much as you can. I know not all of us can be perfect. I get it. I want you to think about getting like a reverse osmosis water system on your countertop or under your sink. They're about $350. That would be something I would save for and get. Getting clean water and not having heavy metal exposure is really important. Chemical exposure, PFAS, all the things that we need to filter out of our water, just the medications that are in our water from people just dumping their medications down the toilet are kind of scary. So I want you to think about that, the bisphenols, get all that stuff out of there. And then you want to think about, oh, how do I detox my body, right? Extra fibers, you can do like a powdered fiber, psyllium, apple pectin, pectisol C is a good one. I want you to think about glutathione. I want you to think about a B complex, a methylated B complex. There's a really cool supplement called Push Catch that's by Quicksilver. And they have a really good one too, that you have this stuff called liver sauce and you drink a little bit of it, hold it in your mouth, whatever, drink it down. And then they have like a kind of a binder that you would use. So that would be something that you could do. You could do that with some glutathione, which would be helpful. You could do that with a methylated B complex. And then also make sure that you're not being exposed every day to all that stuff. That's what I would think. But it's a really good thing. I need a detox checklist though, Red. I think it's a good idea. Rocco, prayers up. I hope that you stay healthy. He's doing welding and he says he's strong and he says, some of his friends have cancer, but I have nothing. I go stronger genetics. You know what I would get on though, Rocco? I'd get on some glutathione. Just hedge your bets a little bit. It's helpful for detoxing. Red, my mom had lupus and died from it. Okay. Yeah, so always watching out for autoimmunity for you, taking a look at the ANA, running an ENA panel. That would be your best lupus marker panel to run, ENA panel. That's a good idea. Yeah, and your mom was diagnosed late. So yeah, probably had it going on. And then didn't know what was happening, right? Because a lot of people are not testing for ANAs. It's really frustrating. So hang on, I lost my Rocco. You're not a very good motivator. Oh my gosh. I think that we're just all fighting a lot of demons around here. Like chemicals, heavy metals, stress levels, sleep. It's all interesting, isn't it? Pica, yes, red pica. You're right. Which is better, NAC or glutathione? I would say if you can get the liquid glutathione, like Apex's trisomal glutathione or Quicksilver's glutathione or the Designs for Health glutathione, I think those liquid ones are amazing. I think they're the best. Some people can't tolerate sulfur, and sulfur is in glutathione and they can't tolerate it. So maybe NAC would be better. You could do a daily NAC. I have a great product by Apex called Glutathione Recycler. Helps to recycle your glutathione and keep it going. It's got milk thistle and taurine in it. It's got NAC. It's a great product. I take that every day. And then when I start feeling like I'm a little off today, I'll take some liquid glutathione. So I think that you can use both, right? Let's see. Lou says I'm 1 in 1320 homogeneous and speckled, all symptoms of lupus waiting to be seen. Also possible. Okay, APS. So we need to think about what your next steps are, because you're kind of moving into your high enough level that they might give you medication. If they do, go for it, right? We need to calm your immune system down. It's doing some destruction right now. So we need to calm it down. But also, we want to braid in some functional medicine strategies here too. We want to think about vitamin D. We want to think about getting off of gluten and dairy. See if those are bothering you. They might be driving some of this. If you have leaky gut, I'd love to help you fix that. I mean, glutathione is really magical for calming the immune system down. I want you to think about lots of different things. I want you to make sure you're getting sleep. I want to make sure that you're not having a lot of toxins in your environment. So there's so many things I want to tell you. I do have an autoimmune support group if you want some support. I have a whole learning program. So you just run through a bunch of interesting videos that I made for you to learn about all the basics. There's links to supplements. There's links to labs that you can get. There's discounts on supplements, and there's an autoimmune support group with me on a Friday. So, and it's an hour every Friday. So if you want to join something like that, it's $50 a month. The link is in my bio. If you want some support in learning how to braid the functional medicine strategies into, Lou, you need to know kind of how to walk both sides, because, I'm here for whatever's going to work, right? If you have this thing that's quickly progressing, we need to use both strategies. Okay. We need to work that out. Okay. Have you ever seen or heard of AS causing pretty severe systemic illness of ankylosing spondylitis? I've never had a patient that's had that. Mine have always been localized SI joint pain and then joint pain throughout, but I do see a lot of systemic inflammation. I haven't seen somebody that's gone into severe systemic illness. It can happen, but I haven't dealt with a patient like that. I mean, I've been treating people for 30 years. So, but who knows what's coming in tomorrow, right? So, I haven't heard of it, but it does happen. Yeah, it does happen. Okay. Have you ever seen autonomic dysfunction? Mine came post panic attack. Yes. Usually it turns into a bit of a panic attack. Your autonomic nervous system can get a little skewed and a little off, and your blood pressure can get a little off, and your heart can get really racy, and you can lose a lot of perfusion to your blood into your extremities. And if it wasn't making you panicked, I would say you might be a robot, right? So I think that it's important for you to get worked up for like POTS, if that is happening. Also, things that can kind of contribute to that and make that worse is if your blood sugar is not steady. So if your blood sugar is spiking and crashing, that can drive that response. If your cortisol is spiking and crashing along with your blood sugar, that can drive that response. So steadying your blood sugar with protein during the day and veggies and keeping yourself kind of more steady could be a real helpful thing to do. But yeah, I see that a lot. Other things. So I think, Rocco, you got to go. You're taking up too much space here. I have a positive ANA 1 in 640, densifying speckled, positive HLA-B 27, and chronic joint pain since you were 3. Okay, so have you been checked for ankylosing spondylitis to see if that's part of what your situation is? I find that a lot of my patients that have positive HLA-B 27 with chronic joint pain, they often have ankylosing spondylitis, but sometimes they just have joint pain. This densifying speckled pattern doesn't always move toward autoimmunity. So it's a little bit of a weird mixed pattern that you have. So I would say, I would call this, ankylosing spondylitis is autoimmunity. You have chronic joint pain. You have an ANA positive. I would just call it autoimmunity, and I would start working on things that would calm your immune system down. Is that going to be what food triggers you have? Gluten, dairy. The top 5 are going to be gluten, dairy, corn, soy, and eggs. Not that everybody has all of those, but almost everybody has gluten and dairy. It's just really unfortunate, but it is kind of the way it is. So those are going to be food triggers that could drive your inflammation. You might want to, what if you got on an autoimmune paleo diet for like 3 weeks or so, like just meats and veggies, not nightshade veggies? that wouldn't be a bad strategy, just to kind of see, like, is food triggering me? And then you slowly reintroduce one food at a time to see, like, what happens. If you put tomatoes in, does it make your joints hurt? What about, eggplant? What about peppers? Things like that, might want to think about something like that. I'm happy to help you if you want some help. I mean, we brainstorm this stuff in my Friday group and my Tuesday group every single week with everybody, just depending on what everybody has. So if you want some help, pop on over. Rare Garden says HLA-B27 was negative, mostly joint pain bilaterally, and the SI joints mainly sacrum, toes, fingers, spine, etc. Are you hypermobile? Do you have EDS? Do you know? I wonder if you have some hypermobility happening is what I'm wondering. I'm wondering if you have any kind of swelling in any of those joints. What about gastrointestinal parasites? That's a great question. So I do see them in some patients. I do tend to run like a GI map test, which picks up some parasites. It picks up, I see more than anything, I see overgrowth of other types of pathogens like strep and staph or bacteria, like opportunistic bacteria. But I also don't run a test that's so comprehensive on every parasite. So I see it about 25% of the time. I do feel like a lot of the killers that I put people on, that's for the overgrowth of the bad bacteria or gram-negative bacteria or whatever's overgrowing, can kill parasites too. So sometimes we don't know what we're killing. We're just putting in a broad spectrum killer. Oil of oregano, the allicin, maybe berberine. I like GI microbex, which is a nice one. And I add like an oil of oregano or allicin with it. It's a really nice killer, broad spectrum killer. So if you feel like you have that, it's not a bad idea to kind of do a little bit of herbs for killing to see how you feel. Definitely wouldn't hurt you. Okay, JC says, thank you. They've never tested my gut. I'm seeing a new functional medicine doctor in the next few weeks, hoping that's next. Great idea. I think we need to think about doing a Cyrex panel on you and checking for leaky gut through your blood work to see if that's positive. I think that's definitely what I would do first. Okay. Let's see what else. Erica, positive HLA-B27, skin rashes, mostly on the shoulders and back, fevers and terrible joint pain. Okay. So yes, so we've got some joint inflammation. And there's a lot going on here. I wouldn't get totally stuck on the HLA-B27. I would also just do a real good combing through of ANA autoimmunity. And I would do some autoimmune strategies on you to see if the joint pain went away. You have lots of joint pain. You have shoulder back rashes. You have all sorts of symptoms. So what if you did a little autoimmune paleo diet that was restrictive for, a little period of time and then reintroduce some foods? Would that change things? You want to use, when you do things, you want to see, do supplements change anything? Does it make it better or worse? These are all things for us to understand. Do you have food triggers, right? Hi, Beach Babe. I'm glad you're here. Just started on hormone pellets. Any thoughts on those? So I have mixed thoughts on hormone pellets. So it kind of depends on how aggressive they want to be. So it often will bring your hormones up pretty high, and then it'll kind of taper off, and then you'll kind of be bringing it up and down as you go. Now, I have some patients who love their pellets. God willing, man, they would never let me say do anything different because they love them. So see how it makes you feel. If it makes you feel great and you feel better, amazing, do it. If you feel like, gosh, there's a couple weeks after I first get the pellet in, then I feel a little anxious or I feel a little edgy, maybe it feels like it's too much in the beginning. Maybe you want to move to a patch, estrogen patch, and an oral progesterone and maybe a testosterone cream. There's a lot of ways to do this right. There's nothing that's, off the table. So if you feel good on your pellets, go for it. What is done for ankylosing spondylitis? They'll usually put you on a medication called Humira, and that is an immune system modulator, calms the immune system down so it doesn't attack the joints and it doesn't create ankylosing spondylitis. It inflames the joint and sometimes the joint will fuse. So they want to make sure that they get in there and interrupt it, and they should interrupt that. That's an important thing for us to do. And also, gluten and dairy can be a trigger, and glutathione can help. and turmeric can help. And vitamin D needs to be at like 70, 80, or 90. And you need to look at your entire blood work, and you need to really look at it and make sure that you're optimum in all the ranges. Now, and we need to make sure that you're running a good amount of blood work, because oftentimes I see blood work from people and it's just little bits of blood work and they're not really doing a good extensive panel. So that's something to kind of look at as well. Okay, so other... Toad only puts water on your body. Okay. All right. I'm not a naturopath, no. And I don't prescribe. I'm a nutritionist, and I've specialized in advanced functional medicine clinician. I've done that program. I'm also a chiropractor. I'm all of those things. I've done chiropractic for 30 years, and I got all of my advanced functional medicine clinician certification in the last 15 years. And I became a nutritionist as well. So, but I'm not a prescriber. But I work with a lot of doctors that are prescribers, and they send me a lot of their autoimmune people because I do a lot of the functional medicine strategies to calm down the autoimmunity. But I can run labs, and I can run GI maps and detox pathway type testing. I can do genetic testing. I can run all the tests, but I just don't prescribe. But I have a lot of good people around me that do, which is great. So let's see, I've had a positive ANA 1 in 640, homogeneous, and a week later was retested and ANA was 1 in 160. Okay, interesting. So things are shifting a lot on you. Your immune system was super active. And I wonder if you had like a virus that you were dealing with or bacteria that you were dealing with, and that drove your immune system a little higher. I don't know. It's possible. It's something that I would keep an eyeball on. And I would certainly understand that you have autoimmunity. Okay. Your immune system is overacting. It's attacking a part of your body. That's important for you to know. Whether it's high or low or shifting or changing patterns, it's still autoimmunity. So we need some autoimmune strategies to try to like chill this out so that we can figure out strategies to calm it down. I find that a lot of my patients do really well when they have a weekly meeting. It's kind of like an AA meeting. We're talking about like gluten and dairy and supplements and flare-ups and all those types of things. And it helps us all stay on track so that we can kind of also listen to other people's stories and understand like, oh, I can do that too. So it's a really niche-y group that I work with, which is great. You might need that support. If you do, just reach out. There's a link in my bio. It's called the Autoimmune Shift. What if you have well water? That's a really great question. You know, I would still probably do a reverse osmosis water system because there's a lot of stuff in the groundwater. And there's minerals like arsenic and cadmium, and I would love to get your well water tested and see what's in there. Sometimes you can have naturally occurring lead in the ground. You can have radon in the ground. There's a lot of things in well water. So it's a question mark, right? It'd be interesting to test. I still think it would be good to have it filtered so you can make sure you're filtering out any kind of heavy metals that could be in there. And that is, yeah, I think we have to kind of block Toad because I just don't like all the people that are kind of disruptive. I really want to get to you guys' good questions. So PCP says lupus, but rheumatologist says no lupus. I have very mild symptoms, so I'm confused. Okay. Rheumatologist is probably right, but you probably haven't hit that threshold, right? But you're developing this. Like this is something that's coming to a theater near you. So we should really work hard on calming this down. There are some very good functional medicine strategies that have lots of white papers behind them that really are good strategies to calm your immune system down. We want to think about things that are driving your immune system. What are the food proteins that are driving your immune system? Do you have leaky gut? How's your vitamin D? How's your glutathione level? Are you being exposed to chemicals that are driving this? How's your stress level? How are your hormones? Because when your hormones spike and crash, it can drive autoimmunity. Like after you have a baby, it can trigger. When you go into menopause, it can trigger. Like hormones are a big deal on keeping it calm. So it might be important for you to stay on hormone support if you're going through a hormone transition to keep your immune system steady. Because oftentimes when women run out of hormones, there goes their autoimmunity. It's a big deal. So I'm happy to help you kind of sort that if you need some support. But also you're kind of getting into the danger zone. If someone says lupus, someone says no lupus, we want to go, okay, fine, but let's not go through that door. Okay. If there's a way to turn this around and go back, let's do it. there are ways to calm this down before you get full-blown disease, is what I'm trying to tell you, okay? Diane says, I feel like I have lupus, so many signs of lupus and a positive ANA. Okay, so I would get an ENA panel done, ask for an ENA panel. That will be very specific toward lupus. Or you can do an ANA cascade, which tells you a lot of different tissues that could be involved. If you can't get labs, if you're frustrated and you're like, no one runs labs on me, you can always message me because there's a Quest Cash Labs is available. And I can run it through anybody in the US. All I need is your name and your email. You could DM me and say, I want to get my labs done. I need an ANA cascade done. You can do it with cash. It might be $40. An ANA screen is like $7. So these things can be really inexpensive if you want them run. If you're having a hard time getting it run, let me know. This is not hard to just send in a link and just send it to you, and you pay cash and you just go straight to Quest. So, yes, where am I? Hold on a second. I just lost my point. Oh, where was I? Okay. Okay. Have you found any peptides help for RA as an adjunctive? Well, GLP-1 has been really helpful. Weirdly, probably KPV is probably going to be really helpful. Maybe BPC 157, but GLP-1 has been weirdly changed the game for RA. Wild. And I mean, it's just an anti-inflammatory mechanism. And GLP-1 is a peptide. So that's helpful. Does colitis really register as an autoimmune in blood work? No, it wouldn't. Celiac would, but colitis is kind of like an inflammation in the gut lining. They can even call it microscopic colitis. Oftentimes it's due to a gluten intolerance. It's not full-blown celiac, but it's creating an inflammation in the gut lining. So I would get off of gluten. I would get off of dairy and see how you feel. It might calm that down. Also, I've been finding a lot of people low in B1 causing a lot of like IBS type symptoms. That's been really interesting. You could take something called benfotiamine. I don't even know how to say that. Some people say it's Benfomax is one of them, up by Pure Encapsulations. It's a B1, active form of B1. That's been really helpful. Okay, please discuss RA and AS more, especially if imaging shows marrow edema and inflammation of the SI joints and sacrum. Okay. So rheumatoid arthritis is going to be joint-based, but it's also going to have two different markers that are going to be positive in your blood work: rheumatoid factor and anti-CCP, okay? And then ankylosing spondylitis is harder because it's going to say positive HLA-B27, but then you're going to see imaging that's going to have a lot of inflammation in the joints. So if that's the case, then I would if you are negative for rheumatoid arthritis and they're not really sure about ankylosing spondylitis, I have a couple patients that have just gotten on Humira and it's been calming down that joint inflammation. And that was the answer for them. It was autoimmune, but it wasn't positive ANA. And it was negative rheumatoid arthritis, but yet it wound up being ankylosing spondylitis. So it takes a curious rheumatologist to try to figure this out. So something's going on and we need to sort it out. We need to start calming this down, because if it is ankylosing spondylitis, you could get joint destruction. You could get joint fusion, which is just a disaster. I'd rather prevent that and have you be on a Humira than have it happen and have you have destruction and fusion. Diane says, rash, I broke my hip. I'm only 44, so many more signs. Okay, Diane, I would love you to get an ANA cascade and really figure this out, or an ENA panel, and really sort this out. And if you have, it sounds like you have autoimmunity, possibly. Let's get you armed and ready for battle, right? You need to know all these things. I need to teach you all these things about how to calm this down. Get your vitamin D where it needs to be. Figure out if you have leaky gut. Figure out the food triggers. I mean, if you get on fish oils, are really helpful and anti-inflammatory. Let's look at your blood work. Let's make sure that your blood sugar is not spiking or crashing, or you don't have prediabetes. That's important. Blood sugar rising can drive autoimmunity. And that really happens when you get into perimenopause. All of a sudden you're like pre-diabetic and you're like, what the heck, right? Maybe you got to get on a CGM, blood sugar monitor, right? This is it's like one of those books that's like choose your own adventure. And you like go to the next page and you're like, oh, because you chose this, you get this. You chose this and you get this. It's like this crazy thing. And not anybody's story is the same. That's why it's hard to give you a super recipe. That's why I made an autoimmune shift program. You get in, you pay $50, you watch a ton of videos, You can get all these links to supplements. You get a discount on supplements, and you talk to me once a week. And it's your accountability partner, and it helps you figure out what to do next. And then you can pull yourself out of this. Because Diane, by the way, modern medicine isn't going to do it. The rheumatologists that are my friends are like, listen, we're overwhelmed. We only have 15 minutes per patient. We're super exhausted. We can't figure this out. And I don't have time to teach them. I mean, the best thing I could do is say, maybe get off of gluten and get on vitamin D. Amazing. That's great. I'm glad that's permeated the permaculture of the rheumatologists. They're actually doing a better job at that, some of them. Anyway, I live in California. Maybe they're better here. I'm not sure. But also, you have to know so much more, and you have to be your own advocate, and you have to learn a lot of stuff. So I'm giving you like a college course, okay? Like a 101 to 201 level college course. Graduate with like, I know a lot about autoimmunity. I have another level of a course that's even higher if you want to know more. I'll give you access to all those videos. I have 50 videos. They're amazing. I just have to just tell me you want to start. I'm ready for you. Because you gotta lead the way though. Your rheumatologist is not going to lead the way. Erica, I'm so glad that you're here. And the rheumatologists, they can be great, but there can also just be like, I'm just staying in my lane and give you medication. And by the way, if you're not bad enough, move along. I don't have anything to tell you. So I find that, let me tell you a little snippet about why I preach about gluten and dairy. Okay. So gluten and dairy have proteins in them. Okay. Gluten, wheat. Okay. Gluten and gliadin, they're the proteins of wheat, okay? And then dairy has casein, okay? Those are protein structures of these foods. This is the weirdest thing you'll ever hear. It's called molecular mimicry. Gluten and dairy look so similar to the tissue of our bodies that our immune system can't tell the difference. It's like gluten, dairy, my body. You eat gluten and dairy, it drives the immune system to attack you more. It's called molecular mimicry. You can look it up. It's real science, a real thing. And so what happens is the immune system is like, I'm overwhelmed. I can't differentiate between all these things. So we take away the foods that are triggers. We help to calm the immune system down. We try to get the immune system to be like less inflamed, the body less inflamed, more fish oils. We get your vitamin D in, get your vitamin A in, make sure you have a B complex. Let's detox your liver. Not hard, B complex with like a methylated B complex with like glutathione. Super helpful. Glutathione is an immune system modulator. It calms it down. So is vitamin D. We're going to calm your immune system down. We're going to steady your blood sugar. We're going to give you lots of extra plants to eat because it's great for your microbiome, helps your immune system. Like there's just like, it's a web, right? But you have to decide where you're starting on the web and how you're crawling through the web, figuring out all the things. Not everybody starts in the same spot. Some people, it started with COVID. Some people have genetic markers. Some people, it started because they had a chemical exposure. Some people, their blood sugar's too high. Like, I don't know, their hormones shifted. They had a really stressful event. They had a baby, whatever. So it's all a web, and you have to like go through and pull on things and try to change things. And then we learn things as we go. But you need a guide. This is like, you need a guide to help you sort this out because it's hard. And this is what I do. This is why I made this program, because I'm like, people don't know enough. Practitioners don't know about. I've had my MD friends go through my program and they're like, oh my God, I learned so much. I'm like, yeah, you didn't learn this in school. Anyway, I'm on a tangent. Sorry. Does PCOS cause inflammation? Yes. PCOS, polycystic ovarian syndrome. Okay. You have like cysts on the ovaries. Why? Because your insulin's getting too high. Why is your insulin too high? It's because your blood sugar got too high. So too many carbs and sugars, American diet, welcome, right? Blood sugar spikes, insulin spikes. What goes along with that? It drives inflammation. So they all come together. Yes. Then you get too much belly fat. Okay. And then your estrogen gets converted into testosterone. And the testosterone causes you to grow a little extra hair, causes you to like not ovulate on the regular. Because why would you ovulate when you have too much testosterone? Your body's like, what's going on? So we got to get you on a testosterone blocker. It's easy to do. There's a really great supplement that's, there's a couple. Inositol is really good. Berberine is really good for the blood sugar. Also getting on CDG estradiol, like a indole 3-carbinol or a DIM to help you clean out your estrogen detox pathways, clear out your testosterone. Eat protein like it's your job. Veggies and protein. Clear out a lot of the carbs. Get yourself a continuous glucose monitor on the back of your arm. Steady yourself. we can get rid of PCOS. It's not hard. We just have to change some things. And this is why I call my whole program called the Autoimmune Shift, slow shifts, little bits at a time, nothing overwhelming, just little bits. I'm sounding overwhelming because I'm just throwing it all at you, but we don't have to go that fast, right? We can just go one thing at a time. Add more protein in, 100 grams a day. Shoot for that, okay? So that's a long answer to one question. Okay, I've been diagnosed with rheumatoid arthritis and then diagnosed with fibromyalgia. Any supplement recommendation? Okay, rheumatoid arthritis is one of the autoimmune conditions that has the most reactions to foods. So I would say start at an autoimmune paleo diet for you. This is like, you can look it up, autoimmune paleo diet. It was created by Dr. Karazian, AIP, okay? You're getting off of foods that could trigger you, possibly. Not all of them will. You're getting off all the grains, gluten included, rice, all the grains, millet, all the things. You're getting off of eggs and dairy. You're getting off of nightshades, tomatoes, potatoes, eggplants, and peppers. What else? Lectins, nuts and seeds, peanuts, peas, pretty much. You're just going to eat meats and veggies. That's what you're going to eat, just for a little while. Get soy out too. Soy's out. And then you kind of go do coconut aminos on some veggies and some meats. Make a stir fry, right? You do that for a while, just maybe a couple weeks. And then you slowly reintroduce foods. Maybe you start with adding some nuts and seeds in. Maybe you add the tomatoes in and the peppers in and the eggplant in. If you feel fine, you watch your hands, you watch your joints. If you put in peppers and it hurts your joints, you're like, okay, peppers are out. Let's go to the next thing. Okay. Put in the rice, put in the potatoes. That's how you work. It's called elimination and provocation. It's the best gold standard food intolerance test you can do, and it's free. Okay. Autoimmune paleo. I have a downloadable in my program. I have one thing. If you go to my, my bio and you click on Linktree, you can get a free download that's for essential labs for everybody. So labs that are essential for everybody to get done. In my program though, if you get in my autoimmune shift, you could, there's a downloadable on the autoimmune paleo diet and how you do it and how you break it down and how you get it done. But that's, and supplement wise on top of that, Adrienne, I would say I would get on a very specific fish oil that's called SPM. S as in Sam, PM as in monster, SPM. And they're called pro-resolvins. They help you to resolve inflammation. Amazing supplement, amazing for joint pain, for fibromyalgia, amazing. I also want you to get on vitamin D, and I need your vitamin D, you guys. I need you to take it and have your vitamin D be 70, 80, or 90, okay? Everyone's coming in with their vitamin D being 30. That's not going to cut it. It's an immune system modulator. You got to use that. It's an easy, powerful tool. So get on vitamin D, get on SPM fish oils. If you need any links, let me know. Just DM me and give me your email and I'll send you a link. That's an easy way to do it. That, and I think I would do, what would I do? I'd probably get on some glutathione for you with rheumatoid arthritis and fibromyalgia. Glutathione, most of the people that are in my program are like, glutathione made the biggest change for me. They feel a bunch better. So that's what I would do. Yeah, I know it's hard, Rare Garden. It's hard, all these things to try to figure out, isn't it? It's incredibly hard to get off gluten when battling weight loss. I gave up. I know it's hard, right? Here's the thing though. There are some great gluten-free substitutes going on right now. What is it called? There's a bread place you can, I don't know where you live, Erica, but there's some great gluten-free bakeries and some gluten-free sub-ins that you could use to kind of prop yourself up while you're getting off. Let me tell you why you're having a hard time getting off. Gluten has something in it called gluteomorphin. There's also one in dairy called casomorphin. Now, these are morphine-like substances that make you feel amazing when you eat them. You eat gluten and dairy and you're like, oh my God, I love this so much. It's the best thing ever. That's gluteomorphin. It's like a morphine. It makes your brain feel like it's been on morphine. It's very addictive. And so, yes, it's really hard to get off of gluten when you've been on it. It's like getting off of heroin. And I'm not kidding you. It really is. So if you have that response, just know that that's what you're up against. Okay. So, and know that if you got off and you decided to cheat one day, it's almost like being an alcoholic and tumbling right down a hole and starting back on alcohol again. Like, it's incredibly hard. So I empathize with you. I work with patients every day trying to do this. If you want support, come over. I'll help you. You can be in my support group. I have a gal right now that fell off the wagon and she's back to eating McDonald's and back to eating buns at Chick-fil-A. And I'm like, oh my God. So we just have to support her, right? I mean, you're not wrong. This is stuff that is designed to make you be addicted to it. It's working, right? So no shame in that. Let's just get you some support. You just need some support. This is like, I swear I'm running an AA meeting for like gluten and dairy in my autoimmune support group. Okay, Sunflower says low white blood cell, TSH is 0.06, normal T4 and T3. What can cause low white blood cells? I have extreme fatigue. I'll bet you have, and ferritin is normal. I'll bet you have Hashimoto's. Have you been tested for Hashimoto's? I'll bet you do, because Hashimoto's can cause extreme fatigue even if your thyroid is normal. So we need to think about the ways to manage Hashimoto's. It will cause you to be super exhausted. So your immune system is up and it's attacking. That's what's making you feel exhausted. Your immune system is taking a lot of your energy to attack your own self. It's messed up. So if you can get off of gluten and dairy to try to see if that helps, try it. You need to be on selenium, 200 micrograms a day, or eat 2 of those weird Brazil nuts a day. You know, those big giant nuts in the nut mix that nobody eats. Those have a ton of selenium in them. So try them if you like. Also figuring out, there's a really cool supplement that I would love for you to be on. It's called Thyroflam, FLM, and it's for Hashimoto's. It's through Apex, and I can send you a link if you want one. Don't get it off Amazon. It's too expensive. I can get it for you a lot cheaper. Just FYI, if you're trying to get professional grade supplements on Amazon, please don't. You're playing 2X. Please send me a message. I will send you a link and I will send you anything you want. You will get it under the umbrella of my account at a discount. And it's a purified, for sure, guaranteed quality supplement. It's not garbage. We don't know what we're getting on Amazon all the time, so be careful. So let me know if you want that. We want to calm your immune system down. We want to calm down the inflammation in your thyroid. You can also get a glutathione cream and rub it on your thyroid. You can do a glutathione cream on your joints if your joints are hurting. Really, really helpful for inflammation. It'll help calm down the inflammation. And once that we find, Sunflower, what changes you, what makes you feel better, that's diagnostic. Then we go, well, this is what it is for you. Maybe it's gluten. Maybe you need glutathione. Maybe, I don't know. The Thyroflam has some selenium in it, and it's also got black seed oil in it, black cumin seed oil. It's an extremely good anti-inflammatory for Hashimoto's. So I hope that helps. Let me know if you need some help. I really will help you guys. I'm not like just kind of being a jerk out here. I'll really like send you supplement links if you want it. Tiffany says, I'm POTS, HEDS, suspect MCAS, and autonomic ganglionopathy antibodies. Okay, you got it going on, Tiffany. Okay, so you're getting rashes, you have hypermobility, you have POTS. Yes, some of my patients are having really good experience with an injection, like a stellate ganglion block. That's been interesting. You have autoimmunity 100% with the ganglionopathy antibodies. You have autoimmunity. We have to get your immune system to calm down. I need to teach you all the strategies on how to do that, right? So it's definitely going to be food for you. We've got to figure out your food triggers. Now, when you have EDS, you also have a tendency to have leaky gut because your junctions aren't tight. They tend to be loose, right? And then you can have food proteins just going through the tight junctions in your gut are just like your joints. They're hypermobile. They're too flexible. They're too open. They open up easily. And then the mast cells come through and you get hives. Okay. But we need to just think you have autoimmunity too. So we have to calm down the attack. Vitamin D is going to be really important. I would think about, I wonder if you would react well to butyrate. Butyrate can be helpful with healing and sealing a leaky gut. Any kind of short chain fatty acids like that. Butyrate, propionate, acetate, helpful. I would think about going slowly with supplements because you could tend to get hives from supplements. What else? Lots of things I would think about with you. I would love to see your blood work. I would love to see, I just want to like dig in with you because there's a lot going on there. But let me know if I can help. I don't know if anybody's managing you. But you need to like assume, you have autoimmunity. And so when you have one autoimmune condition, you can often develop a second one. So this is why it's really important to try to get this to calm down. This is why I'm so frantically trying to teach everybody how to do this, because it can get worse and we don't want that. It can get worse because it's worse destruction, but then you can develop another autoimmune condition. So this is why I'm like on my preacher's pulpit right now going, guys, come over. Let's figure this out. Let's calm this down. Let's get you on the D. Let's get you on all the supplements that make sense for you. But also we got to get you sleeping. We got to get you your hormones right. We got to make sure that your food is right. Do you have enough veggies in your diet to support your microbiome? Okay. You got to grow your microbiome. You got to have enough plants, but you also got to have some meats to make sure your blood sugar stays steady. Oh my God, I'm so lost on where I am on these comments. I'm so sorry. Okay. Any advice to raise the low white blood cells having Hashimoto's? Good question. I need you to eat protein like it's your job. I need you to have 100 grams of protein a day, because your entire white cells and immune system are built out of protein. Okay. So that's important for you to know. So I'm reacting to most food, swelling up and flaring butterfly rash, low vitamin D, Sjogren's. Okay. You got it rolling, my friend. Okay. So we got to make sure that you don't have leaky gut, because I bet you do. You could have low leaky gut that is opened up, and now all of a sudden every food is going straight to your bloodstream. Okay. Don't do a food intolerance test right now, because everything will show positive, because your barriers are probably broken. Okay. You probably have a pretty severe leaky gut where you eat food and it doesn't stay in your food tube, just go straight into your bloodstream. And then you develop hives and then you react to all the foods. It's like a nightmare, right? So we'd have to figure out like how to get you on a really simple diet and how to seal the gut back up. Immunoglobulins can help. Bovine serum derived immunoglobulins that are dairy-free, helpful. Sometimes butyrate can be helpful, but we have to kind of figure this out. We got to get your vitamin D in. Get on the liquid vitamin D. It absorbs faster than the capsule vitamin D. Nicole, if you want some help, reach out to me. I do have an autoimmune support group. I'd love to help you. Somebody is saying hello from Central Europe. Greetings from, how do you say that? Thescovia. Welcome, Sleepy Cat Max. Love it. It's so funny. They made your message gray like it was some sort of weird like message, like they're blocking you. That's weird. Anyway, it's weird. This app is weird sometimes. Okay, she also said mixed connective tissue disease and investigating and sending on biopsy. I'm exhausted. Oh, yeah, Sleepy Max is exhausted too. Nicole says gluten reduces the swelling. Gluten reduces the swelling, or gluten-free reduces the swelling? Okay. Yeah, we got to get your food figured out. You guys, when you're exhausted, your immune system is spending a lot of energy doing something that's not taking care of your body. It's attacking you, right? Or driving inflammation. Okay. So this is all stuff that makes you feel super exhausted. So, and sometimes you can take fish oils that can help resolve some of this inflammation, but sometimes you can't generate enough energy to actually resolve the inflammation. So then I'll give you something like an NAD plus precursors like NR or NMN that make more NAD plus that can just drive energy, so that you can have enough energy to do something, right? To even resolve your inflammation. But we have to figure out what the triggers are, right? So this is why it gets kind of tangly jangly, right? It's like, where do we start? Well, it depends on what's going on, right? What drove this? Genetics or COVID or exhaustion? I mean, stress, right? So Nicole, you have a lot going on. Yes, you are suffering. I want you, oh my goodness, there's so much going on there, Nicole. I think, you know where I would start? I would start by doing a leaky gut test on you through a company called Cyrex, Cyrex. And it would test you for simple leaky gut or more complex leaky gut, which would say high lipopolysaccharides or high LPS. And we have to seal the gut up first. There's no way to calm any of this down until we seal the gut lining up with. If you want to have a consultation with me, it's in a link in my bio. Just click on my bio. There's a link tree. There's a join my autoimmune shift. There's a link to see me, whatever you want to do. I really love to help you. My goodness, there's so many people to help. It's like, I just want to help all of you guys. Propranolol helping, but steroid barely, trying to reduce dairy. It's hard. It's so hard. Isn't it? And a biopsy coming for celiacs now in Sjogren's. Okay, good. Gathering data. You probably can't tolerate gluten no matter what. It doesn't matter if it's celiac. Gluten and dairy just will screw you up. A biopsy not necessarily will determine a connective tissue disorder. She's probably doing a lip biopsy to see if she has Sjogren's. Yeah, or a salivary gland. No other autoimmune, but I think you have plenty of autoimmune to go around. Your immune system is going a little haywire. So sometimes they'll put you on like, a Plaquenil or, hydroxychloroquine, or they'll put you on something like a methotrexate. If they feel like they need to do something like that and you feel like you're on fire, please let them put the fire out. Please let them do that. And then we can jump in and braid in some functional medicine strategies and help you. But, when you feel like you're on fire, sometimes you just need to go to the fire department first. Then we help sort you out. Okay. She's looking how my body's taking in vitamin levels. That's good. Yes. But also you want to make sure you're taking probably a liquid vitamin D. And maybe if you were going to do something, I would even do a liquid A and a liquid D and put it straight into your mouth and let it soak. I'd do a B complex that's liquid and let it soak into your mouth. I wouldn't even trust your gut to even break down capsules because it's probably not doing a great job of that. So, Mel, thanks. I'm glad you're on. Thanks. Yeah, I'm hoping to have some good info for you to help you guys get armed with information. You just started a biologic called Enbrel. 4 doses. I feel no relief. Okay. Do you have rheumatoid arthritis? Weirdest thing, Mel. I'm telling you, I have a few patients who have rheumatoid arthritis, and I think that might be what you have, that have had no help with Enbrel and were, some do, some don't, right? And they got 3 of them. They got on a GLP-1 and their pain went away. What? Crazy. It's blocking inflammation. And then we can get to the bottom of it. Then we can dig deeper and go, where did this come from? And how do we also support you? I'm always happy to be a background singer. When someone has a rheumatologist that's like hammering them, great, let them do it. And I'll help you on the back end and help you do with the functional medicine strategies. I am not a prescriber, but I know so much about what with autoimmunity that I can help figure it out. Taylor, hello. What did I specialize as in my residency? I did 1,200 hours of functional medicine training is what I did. So it's not a residency. I'm not a medical doctor, but I've done 1,200 hours of functional medicine training. So I know a lot about functional medicine, and I'm a nutritionist as well. Vitamin D and magnesium is saving me. Good. Okay. Nicole, when you have a supplement that makes a difference like that, you have to think this is diagnostic. Okay. This is helpful. Don't ever drop it off. And if you feel like there's something that's super helping, you want to go do that twice a day, maybe. And then we have to look at the mechanisms. Vitamin D is an immune system modulator. It calms you down. Maybe you could layer some glutathione in there. That wouldn't be a bad strategy. Would it flare you up? I hope not. I have Hashis. My CRP and LDL is high. Trying to find out where the inflammation is coming from. Okay. It might be this destruction of your thyroid, possibly. It might be that you're reacting to gluten and dairy and you might have gut inflammation, possibly. It'd be interesting to check out your blood sugar and see what's happening there. Make sure your blood sugar is not getting too high. All sorts of things to consider there. The immune system is attacking the thyroid and it's breaking down the thyroid, and that is creating a destruction. So maybe that could be part of it. You could get on some glutathione orally. You could get the glutathione cream to rub on your thyroid that might help calm it down. It's called Oxycell. It's by Apex. Happy to send you a link if you want. Nicole, and your eyes are very dry and suffering. Nicole, I just want to give you all the help. Nicole, you win the prize on the most amount of garbage going on right now. I am so sorry. Let's try to help you figure this out. And when you get done at the end of, hey, medicine says this is all I can do, then you jump off into the pool of, I can help you beyond that too. I can give you all the different other strategies that are going on that we can put in that are super, super helpful, because they'll run out of steam. They'll get you to a point and then you won't be able to go anymore. So once you hit the end of the road, message me. I'm happy to help you kind of put in some more strategies. Okay, Mel says the only thing that seems to help is prednisone and has caused me necrosis in my hip. Right. Yes. I wonder if you would consider a low dose of GLP-1. I just wonder if your doctors would help you with that, or if you could go to a naturopath to get that, just as an experiment to see if it helped you. It might really help a lot. And there's not a lot of side effects, especially if you don't go too high. If you went like a small dose. So everything. Yes, you have everything, Nicole. I just want to give you all the support. Adrian, come over. Come over. And when you join, I'll send you an email with everything you need to know, all the times that you can meet. Right now, we have 2 times going on. So I have a Tuesday. I'm in California. So I have a Tuesday. I'm starting a Tuesday at 4 p.m. Pacific. I also have a Friday at 11 a.m. Pacific. So you let me know what times work for you and we'll make them work for you. So come over. It's great. I'm telling you, you need some support. You can sign up and send me your labs. Yeah, absolutely. Go to my bio and just click on my link tree and there's all the different options you could do. I'm happy to help. Best foods to help fix leaky gut. Great question, Mocha. I love that question. So first I would put you on a short chain fatty acid. Okay, it's a supplement. It has butyrate, acetate, propionate, helpful for healing leaky gut. Aloe vera helps to soothe the leaky gut. Glutamine helps to heal a leaky gut. But then you want to think about cooked foods, okay? Cooked veggies, cooked fruits, cooked. Just calm variety of mostly vegetables, okay? And I want you to do a good variety of a lot of things you probably never do. It helps to get your microbiome going. Your microbiome is going to make short chain fatty acids, which also seals your gut. It's like a self-healing system in there if we feed those guys. The microbiome is magic. So you just have to feed them. They love plants. Are we eating enough plants? Are we eating enough veggies? Be careful about raw veggies that might hurt your gut, but cooked veggies, super helpful, okay? If you can tolerate fermented foods, do it. But if you can't, because it maybe gives you a histamine reaction, don't do that. This is why everybody's a little bit different. So take my advice with a grain of salt and tailor it how it makes sense for you. But don't do something if it doesn't work for you, okay? Yes, Mel, this is why you fall off the wagon. I'm telling you, this is about gluten and dairy, right? Gluten and dairy addictions, it's like morphine, literally, seriously. You have Hashimoto's, but your thyroid is normal. Great. This is early times, Rosella, early days. So you want to make sure that we calm your immune system down so it doesn't continue, right? So you want to make sure that if your thyroid is getting attacked for 10 years, slowly your thyroid is going to start slowing down. Okay. It's going to start not be working as well. So love that it's still functioning well. Why is your immune system attacking you? That's the question, right? What happened to you is the question. Was it COVID? Is this something that's genetic that goes down on the female side? A lot of times it comes down the female side. 80% of autoimmunity is female. It tends to be on the X chromosome. Men have 2 of those. Men have one of those. They have an XY. Women have 2. So we have a higher chance of having autoimmunity. There's this autoimmune regulator part of the gene called FOXP3 gene. Really amazing that we figured this out. Nobel Prize of Science figured that out this past year. Amazing. So this is why women have more of this. Okay. So we want to figure out what happened to you, right? Did you go through a really stressful time? Did your hormones get wacky? Did you get exposed to chemicals? What happened to you, right? Have you been sensitive to gluten and dairy all along and you didn't know? Did you get leaky gut, right? Did you have a virus? Did you have mono? Man, mono is bad. It triggers a lot of the stuff. So does H. pylori in your stomach. Recently found out that my liver's enlarged. Could it be autoimmune if I already had Hashimoto's? Possibly. We want to make sure that you don't have autoimmune hepatitis. That's something you can test for. It's in your blood work. Good thing to check for. And if your liver is enlarged and it's not autoimmune hepatitis, then we just need to give your liver some herbs and some support. Yeah, milk thistle and dandelion root would be lovely for your liver and making sure your blood sugar is not getting too high. High blood sugar can make your liver a little bit messed up. Oh, the supplement for Hashimoto's is Thyroflam, FLM. Thyro, THYRO, FLM. It's by Apex Energetics. I can give you a very inexpensive link if you want it. It's through Full Script. It just gives you direct access to order straight from them versus someone that's a second or third seller that's going to be on Amazon. You're going to pay way more. And I would do like 2 in the morning, 2 in the afternoon. Just do it. Get it in there. What can I do if I have if they have the HLA-B27 gene? Well, there's nothing to do about that, but also we want to make sure that you're not developing something that is associated with HLA-B27, like ankylosing spondylitis. If you have any kind of joint pain, SI joint pain, something like that would be something to consider to try to figure out, because ankylosing spondylitis, or AS, doesn't go along with ANA. It's a negative ANA. It's really frustrating. So what are the best supplements for arthritis and osteopenia? Okay, osteopenia, let's talk about this real quick. And then I have to go have dinner in a minute. So every night I do this, and every night I'm like, my husband's like, when are we having dinner? I'm like, I don't know. I'm on my life. Leave me alone. Thank goodness he's really like, he's like, go do it. Okay. Arthritis, osteopenia. Osteopenia is low bone density, right? It's going toward osteoporosis. So we want to think about basics: vitamin D3 with vitamin K2 combo. Okay. 5,000 I use of vitamin D3, and then K2 kind of goes on as an adjunct. And then I want you to think about looking at your blood sugar. Is your blood sugar getting too high? Are you getting prediabetes? Is your hemoglobin A1C over, say, 5.2, 5.3? That drives inflammation. If you have inflammation, that'll turn on something called osteoblasts in your bones. Blasts is, hold on. Nope, blasts are the buildup. I got that wrong. Osteoclasts. Osteoclasts are the breakdowners. Osteoblasts are the builders. So you want to drive the builders and slow down the osteoclasts. So when you have inflammation, your bone breaks down. That's what happens. That's why if you have inflammation, your bones can just break down. You can get osteoporosis. And it's like, why? Because you had inflammation. So that's number one. And then protein. And you need to eat protein like it's your job, like 100 grams a day. It helps to build bone. Okay. So I want you to have protein. I want you to have low inflammation, maybe a fish oil, maybe make sure your blood sugar is regulated, make sure you're not getting diabetes or prediabetes. Get a CGM, continuous glucose monitor, if you need it. Be on vitamin D3, 5,000 IU with a K2. Okay. If you need a link, let me know. Also, I like a little osteoporosis supplement. Who's it by? Designs for Health. What's it called? Osteo Strong, Osteo something. It has just a bunch of minerals in it. Manganese, silica, boron, vanadium. I mean, all the minerals, right? All of them. And not just calcium, because if you just do calcium, it can get stuck in your heart. It can drive heart disease. And osteoarthritis, I really like a supplement called ArthroSoothe. It's by Designs for Health. It's got it's got the kitchen sink in there. It's got resveratrol, it's got turmeric, it's got green lip mussels, it's got MSM, it's got glucosamine, chondroitin, boswellia. It's got everything in it. It's kind of a nice supplement. So if you want a link, let me know. I'm treated with, I have a backup of messages. Sorry. Okay. Let's see what else. Cyrex. Yes. Cyrex, Cyrex is the labs. And it's easy. That's how I test for leaky gut. I do it through a blood test through Cyrex. It is a blood test. And it's easy to send you a link and for you to get a blood test done locally and for you to mail it back and for me to get the results and send them to you. That's not hard. You don't have to be in California to do that. MS is also an autoimmune disease, and it's triggered by all the same things. Yeah, MS is a big deal, and we want to get a handle on it. I have a nutritionist in my office that has MS. She has some real special training around that, which is helpful. Mixed connective tissue and have been put on hydroxychloroquine, Cymbalta, and Telcoximig. I don't even know how to say that one. Yeah, how are you feeling? Is it making you feel a little bit better? Hopefully that's helping you a little bit. Hopefully you're braiding in a lot of functional medicine strategies in there too. If your insurance, by the way, covers functional medicine, I can give you a super bill with a million bajillion codes. And if they'll reimburse you, then you have magical insurance. And I'm happy to do that. Yes. I take BPC 157, KPV, GHKCU. Will it interfere to do a gut test like the stool test, gut zoomer? No. Nope. It won't be. Nope. It should be fine. If your gut is healing, say from taking BPC 157 and such and KBV, it's just going to tell you where you are, right? It's not going to be falsified. I think that's going to be fine. For stool test, gut zoomer and GI map. I like them both. I don't really like Vibrant for food testing. I don't think their testing process is as good as Cyrex. But I think with gut testing, I trust their gut zoomer. I trust the GI map. I trust Genova. US Biotech does a really good one too. So all those are pretty good. Okay, you guys, I'm gonna have to pop off because I gotta go have dinner. Oh my gosh, you also have trigeminal neuralgia. Ow. Can you find somebody with a cold laser that can put a cold laser right here for trigeminal neuralgia? I have a cold laser in my office and it seems to really help with the pain of that. That could be a virus in that nerve, by the way. So some antivirals wouldn't be a bad idea. And some vitamin D and some glutathione and some turmeric and all that kind of stuff. Maybe even getting some glutathione cream to put right here on the nerves. Hope that helps. Okay, and just SDSU, babe, I was diagnosed with pernicious anemia, now glutate psoriasis. So you're not absorbing your B12 very well. I wonder if you have a autoimmune condition toward your gut and it isn't allowing you to absorb B12. I'll bet you have a gut autoimmune situation going on there. I would say you're going to have to get B12 shots. You might be able to absorb it orally, but I would have all your Bs tested: B1, B12, B3, B6, B, all the things, just to make sure that it's not just B12. And you have some psoriasis, which is often associated with autoimmunity. I would say get yourself an ANA panel done, test for rheumatoid arthritis, test for all the autoimmune things, just to see if anything's landing. I would get off of gluten and dairy. Psoriasis, get off of gluten and dairy, but get on a good level of vitamin D. If you want some education about how to calm this down, join my autoimmune shift program. I'll tell you how to do it. I have it all wrapped up in videos. I made videos so I don't forget. Like, there's so many things to tell you that I just want you to run through all the things, know all the things, and pop into the support group with me. You have all the links. I can send you links for different supplements. It's a super fun group. And it's listen, you guys need some support. Yeah, so get off of those, try those. I'm getting a blessing from Jack. So nice. Okay, and positive ANA, Smith antibody 16 is NRNP 44 and a pneuma-like pattern. I'm 26. Okay, you could be building something here, Savage Gunna. So we need to think about getting you off of gluten and dairy. I would get you off of gluten and dairy, maybe even soy. I have a 26-year-old, so I'm just going to boss you like I'm your mom, okay? Because I boss her, and she's got an ANA positive that could go toward lupus, and we've gotten it to go into remission, which is incredible. So let me tell you, this is what we're going to do. We're going to get you on vitamin D, 5,000 IUs every day. We're going to get you on some glutathione every day. I'm going to have you clean up your diet, eat protein with every single meal, get off of gluten, dairy, and soy. Do that. And then if you don't calm down from there, reach out to me. I'm happy to help you. I'm telling you, I have a good heart for these 26-year-olds because that's my daughter right there. I bet you were born in 99 or 2000 or something like that, right? I can help. Let me know. Okay. Okay. I'm treated with psoriatic arthritis, but the only place I have rash is my scalp. Yeah. Yeah, that's just where it's popping in. You probably will get out. If you got off of gluten and dairy, it might help. We need to really work on your microbiome too. Lots of more veggies. We might need to do GI map tests and see who's living in there. Good guys, bad guys. Be happy to help you with that. Osteoarthritis supplement is called ArthroSoothe. That one's a great one. There's an ArthroSoothe Supreme. I don't like it as much. It's by Designs for Health. If you want a link, just tell me and I can send you a link. Anyway, someone is weird is popping on. Okay. Anyway, I need to probably pop off, you guys. Let me just answer one more question. I will. You're welcome, Savage. Someone needs to help you. Let's do it. Okay, Shailene, let me answer your question. Then I got to pop off and have some dinner. And then I'm going to be back on a live on Tuesday. Tomorrow I work late with patients, so I'll probably be back on Tuesday. Probably early dinnerish time, maybe about 5 o'clock Pacific. Okay, Shailene says positive ANA 10160, possible lupus. They say migrating joint pain, only symptom. Okay, these are early days, Shailene. Okay, these are early days. This is a time you got to strike this while you can before this thing moves. Okay, this is almost like a little brush fire. damp it out while it's early times. Once that it consumes the whole forest, it's hard to fix, okay? We want to think about getting on vitamin D, 5,000 IUs every day. I would say get off of gluten and dairy and see how it makes you feel. Does it make you feel better? If it doesn't, I would think about maybe getting some food testing done, maybe a leaky gut panel done. Lots of things you can do. You can get on some glutathione. I know I keep repeating that. It's a magic supplement. So if you want some help finding a good one, I can send you a link to get one. I can send you a link to get vitamin D. Any supplement you want, it's easy because so just through Fullscript, just tell me your name and your email, and I'll just send it to you. If there's a lab that you want, name and email, I can send it to you from Rupa. Not hard. If you want to get on my autoimmune support group, hop on in there. It's the Autoimmune Shift. It's in my link tree. We meet on Fridays at 11 a.m. I'm thinking about making another one on Tuesdays at 4 so I can catch the people that get off of work through the country. So, because I have a lot of people that are like on the East Coast, I'm from Connecticut, I've got Alabama people, I've got Texas people. So I'm just trying to make it so everybody is, can be on it. Okay. So just let me know. I'm going to start, this is a new group on Fridays at 11. I have about 6 people in there right now. My Tuesday at 3:00 group is full, but I'm going to make one, I think, right after that. So that's what I'm thinking. Yeah, Shailene, taking L-glutamine, no dairy, no sugar or gluten, trying so hard. You're doing great. L-glutamine is helpful. Taking vitamin D, make sure you're on 5,000 IUs of vitamin D, okay? If you need some help running any blood work, let me know. I'm happy to help. And I message you my labs. You can just send it to me in a DM if you want to DM me. That's fine on TikTok. I don't always get in. I make videos on TikTok. I don't always get into the comments because I would just be on there forever because there's so many comments, but I will answer my DMs. So if you want me to respond to you, send it in a DM. Okay. And Dawn, thanks for hopping on. Okay, you guys, thanks for hopping on tonight. I'll see you guys probably on Tuesday, or anybody who you know that wants to pop on. I'll be on Tuesday. All right. See you so soon. Whoa. See you guys later.